The guidance in this video is based on the UK Step 4 Guidance 2021. Please check our websites and communications to staff and parents for any changes or updates to this information. In line with government guidance, we are working hard to safely reopen our schools to all staff and pupils at the start of the autumn term, in line with the updated government guidance, as part of Step 4 of the easing of restrictions. We've prepared this short presentation to explain the changes to our working environment and new ways of working. We're looking forward to welcoming everyone back to site after the summer, and hope that this presentation will make sure that we all understand the role we need to play in keeping everyone safe. Some of this information you will have heard before, but some of it is new. It's vital that everyone plays their part in keeping everyone safe by complying with the instructions and expectations in this video. The most important thing that everyone can do is to not come to school if you have symptoms or have tested positive. We expect all staff, pupils and visitors to follow our control measures on site. On return to school, pupils need to be in full uniform, ready and equipped to learn. We have a range of measures in place to support and protect all pupils, staff and visitors. You should wash and sanitize your hands regularly. Catch it, bin it, kill it if you need to cough or sneeze. Make sure that your classrooms and workspaces are well ventilated. Take a rapid lateral flow test twice a week and report the results. Wherever possible, you should walk and pass people on the left and wear a face covering in crowded spaces. We will continue to have a robust process of touchpoint cleaning around our sites. We will offer all pupils 2 lateral flow tests on site on their return to school at the start of the autumn term. Please make sure you have completed your consent form for these tests. If staff or pupils develop these symptoms, they must be tested as soon as possible. It is vital that school is informed of the symptoms and test result. Anyone who feels unwell or experiences symptoms of COVID-19, such as a new persistent cough, high temperature, difficulty breathing, or loss of smell and taste, will need to go home as soon as possible, and arrangements for this will be made with staff and parents. Parents will be expected to collect their child immediately. If a pupil is awaiting collection, they will be moved to the allocated room, where they can be isolated behind a closed door. Anyone sent home must follow the stay-at-home guidance for households with possible or confirmed cases of COVID-19. They must self-isolate and arrange to have a test as soon as possible. The test result must be shared with the school. Parents, pupils and staff must be ready and willing, if necessary, to book a test if they or their child have symptoms, provide details of anyone they have been in close contact with if asked by NHS Track and Trace. We'll be working with the Public Health Protection Team, and, should the need arise, we will follow their guidance regarding sending pupils and staff home to self-isolate. Parents must regularly monitor communications from our schools, should the need arise, to take swift action following a positive case. We may need to reintroduce, as part of our contingency plan, other measures should these be required due to local or national restrictions. You will be notified in advance should this happen. But the measures we may introduce at short notice are staggered start and finish times, as well as staggered lunches and breaks, allocated entrances and exits for pupils and staff, social distancing, and the wearing of face coverings. You must not come to school or work if you have symptoms. This includes a fever, loss of smell or taste, or a new and persistent cough. Washing hands often with soap and water for at least 20 seconds, or using a hand sanitizer when you arrive at home or the school, when blowing your nose, sneezing or coughing, after exercise, visiting the toilet, or before eating and handling food. You must follow good respiratory hygiene, including catch it, bin it, kill it. Avoiding touching your eyes, nose and mouth with unwashed hands. Covering coughs or sneezes with a tissue or your sleeve, then throwing the tissue in a bin and washing your hands. Opening door handles using a clean tissue or paper towel, and disposing of the towel properly in a bin afterwards. Sanitising work equipment such as computer keyboards and telephones with antibacterial surface wipes before and after use. Avoiding gathering or congregating in groups. We expect all staff, pupils and parents to actively participate in the government Track and Trace scheme. From 16th of August 2021, children under the age of 18 years old will no longer be required to self-isolate if they are contacted by NHS Test and Trace as a close contact of a positive COVID-19 case. Instead, children will be contacted by NHS Test and Trace, informed they have been in close contact with a positive case, and advised to take a PCR test. We would encourage all individuals to take a PCR test if advised to do so. Staff and parents must inform the school of any COVID-19 test results. Pupils and staff must leave windows and doors open in classrooms and offices to enable adequate ventilation. The government has removed the requirement to wear face coverings in law, but expects and recommends that they are worn in enclosed and crowded spaces where you may come into contact with people you don't normally meet. This includes public transport and dedicated transport to school or college. We encourage everyone who is eligible to obtain a vaccination when they are invited, and to use the drop-in vaccination centres where no appointment is required. We understand that this is ultimately your choice, and we encourage you to make an informed decision by reading up about COVID-19 vaccinations via official sources, paying attention to the information the NHS provides you with when you are offered a vaccine, and being wary of misinformation around COVID-19 vaccinations put out by unreliable sources. Information on the National COVID-19 Vaccination Programme is set out at www.gov.uk/health-social-care/protection-immunisation and www.nhs.uk/COVID-19/coronavirus-vaccination/coronavirus-vaccine. Visitors to our schools, including parents, must have a pre-booked appointment. Please do not come into our site or reception without first phoning and making an appointment. Only one visitor at a time is allowed in our reception areas for everyone's safety. And finally, it's important that we all recognise that the way we work as a school community has changed, and some of these changes are long-term. Education is not optional, and all pupils are required to attend. Our attendance teams will be monitoring attendance as normal. It is the duty of parents to make sure that their child attends every day unless they have symptoms or have tested positive for COVID-19. If you need any support, please contact your pastoral leader for pupils and parents and the school's business manager for staff. We appreciate all of your support and hope for your commitment to keeping everyone as safe as possible.